is here. Okay, with that said, I think we're ready to shift gears and jump into looking at the charge entry, payment posting, and the billing type functions. So I want to explain just a little bit of the logistics first to show you some of the functionality. Like one thing that's going to be different in Entergy, the concept of people entering into a batch is really called a journal. A journal is the same type concept that I have the ability to keep all of my work together. Multiple people can be keying into the same journal if you set it up that way, or individuals can have their own journal, and people can have multiple journals that they're working in. So similar in batch that I could be working in different batches. But one change in concept is in Success today, you have to open and name the batch every day. In Entergy, the journal is assigned to the user and is available to be used every day without having to go and create it and name it. It's just sitting back there in the background and available. Maybe I have one batch that's mine or journal that I have that is mine that I use for remittances, another one that I use for daily charge entry. And so I would just pick the journal that I want to be working in based on the type of functionality that I'm doing. But those journals would be sitting there assigned to me and available at any time. At the end of the day, if I wanted to see what I had done in my journal that day, I could open up and go in and view the information of what was in that particular batch. So I could go in, I could look at the details of the information, see all the different transactions. If I saw something I said, oh, actually this is wrong, I can actually open that up and edit it directly from that view mode. So without having to leave where I'm at, I could go in and take a look at that type of information. So you do have the ability to go in and look at the journals at any point and work data from those journals as well. So journal management, when you see the term journal in Entergy, it's similar type concept to the batch functionality that you're accustomed to working in today. Where I'm going to start with over here though is let's go into charge posting. First of all, I'm going to make the assumption that we're working with some of the charges that have been pushed over from the clinical side. These would be those patients checked in who have not yet been checked out. So I'm going to go into charges, into pending charges. So these are the ones like in your Today World and Success had been submitted from the eSuper bill. So if I wanted to go in and select that patient, I would just choose the patient's name directly from this window. It's going to give me a quick view of what's going on with the charges that have been pushed over to me. In this case, I only have one CPT code. If there were multiple, they would be listed here. Down at the bottom, again, it's giving me some brief details. In this comment section, if the provider had sent me a note or a follow-up request for the patient to come back in, that's where you would see that. So like your little red box that you have around the encounter to show you that they pushed you a request. But if I were ready to go in and enter the charge data, then I would open this up. Now this particular patient is an old one, so you're seeing some ICD-9 codes rather than ICD-10, so the system is going to prompt me and assist me with matching up the appropriate one, so it's only showing me the options that match the ICD-9 that I have selected there. If I needed to change the order of the diagnosis, moving them up or down, I can do so directly from here. So if I needed to change the order, I'm also able to see what type of insurance that patient currently has, so I have that ability to see that. I can see the account number, referral if there was one, basic information like that. But if this information was right, then I would just say add to add it. It's also giving me a reminder that I don't currently have an updated patient consent on file. And I know someone had a question about a consent form. Let me see. Can you scan the consent forms and treatments and other forms? Yes, you can. You can scan those directly into the system. And you can create your own in correspondence as well, similar to what you do in forms and correspondence today. In this case, I don't have any other charges that were pushed over from the clinical side, but if I needed to add another CPT, just because maybe I knew they had that done as well, I could just add it by keying that code in, and again go in and just say add. If I were done with this patient, then I would go to post charges. Someone had asked about collecting on both the front end and the back end, and this is allowing me to see that it would prompt me to collect on the back end as well. So if you're doing real-time checkout, that might be a question that you would want to have there. If a payment had been collected on the front end, then I would also be able to see that at this point. It would pop up and say $25 was collected. Do you want to go ahead and apply it? You would just say yes, and then it would automatically distribute that money for you. So you do have a couple of options now there, but if I were done with that patient, I would just close it and I'm on to the next patient at that point. I'm going to pause briefly just for a moment. A couple of other questions that have come in. Let's see. Crystal reports, someone wanted to know about using Crystal reports. Entergy comes with a tool called Practice Analytics that you have the ability, if you have business objects or business intelligence today, then that's just going to be a light to light swap out for you. If you don't have that today and you want a very robust reporting tool, you'll be seeing Practice Analytics later today. Eligibility can be run directly through the system, either in batch from the schedule or one by one as I'm checking in patients or scheduling patients. You can split the claims. That's just a setup function like it is in Success today. I do not know of a limit on diagnosis. I don't think there's a max limit, but we can double check that one for you. But I know I've entered 7 or 8 at a time before. You do have the ability to find global periods for patients, like for surgery global periods and things like that. You can review the encounter before posting the charge, so you do have the ability, and that's basically what you're doing here on this screen. This is like going to your charge entry module in Success today and reviewing that charge entry and making any changes, adding a modifier, doing things like that. So let's jump over at this point. So that was to knock out some of the questions, and we can stop again for questions here in a few moments. But just wanted to show you that's basically what you would do with charges that are being pushed over directly from the clinical side, similar to submitting the super bill today. Now, if I were posting a charge that had not come over from the clinical side, functionality would be very similar. It's just instead of having the information populated for me, I would be keying it in. So same screen where you go to put in the information, but just wanted to show you that that's where you would go about doing that. At the end of the day, when you're finished, you would be going into journal management like we talked about earlier, reviewing that information either on the screen, or I could go in and print journals, so if I actually wanted to print reports. Inside of Entergy, there are a number of different reports that can be run directly off the menus here. So if there were certain types of reports I wanted to go in and run, we do have them grouped in different categories here. So if there's information, particular areas that I wanted to go in, I could limit my view down to just the ones in those associated categories. We're also going to be looking at Practice Analytics later, which opens up a whole nother world of additional types of reports that you can do as well. Okay, so at the end of the day, you would process your journal. Once you're finished with that, if you were ready to actually go and process your insurance billing, going to open up the insurance billing area. This is where I could go in. I could see the different batches or journals that were out there that were ready. I could go in and run the pre-bill claims where it's going in and basically preparing the claims. Most of you are familiar with that concept of prepare today. These are not real claims, of course. This is a demo database, so I'm going to jump and just show you some things from a previously posted one where I could, for instance, go in and say I want to see an error log, similar to your error listing that you have in Success today, where I could go through, I could see the different errors. But one thing that's really nice here is that while I'm reviewing this, if I wanted to say, oh, I already took care of getting that consent form, when you hit resolve error, it's actually going to open up that section directly for you here so that you could go ahead and make that change. Or like this one says date of birth, so it's going to open up the patient demographic and allow me to make that change from here. Again, just efficient ways of doing things so that the system takes you to the place where it logically makes sense for you to make that correction. So that if you're going through, you need to resolve some of those errors, you do have the ability to do so directly from reviewing that claim batch that you've done the prepare on. Once you've prepared them and gone through the errors, you then would just transmit the claims or print them, whatever the situation is there. On the back end, once we start receiving the payments, you do have the ability to use the electronic remittance. For those of you that are using ERA today, you're familiar with this process, but this is where you could go in, you could see the different checks that have been processed there. If I wanted to go through and review or work exceptions on these, I could open it up and actually see the report there, and that's just a little help window, but I could go in and say I want to see the exception report, or I'm wanting to look at the full ERA remittance report, so I could select what I want to see and go in and open up that information. So I'm just going to open up the exception report, and it tells me what exceptions it's found. In this case, it didn't find any, so it's telling me that there's none there, but if there were exceptions, it would give you the listing of the ones that you individually need to go back in and look at. It's similar to exception types and, you know, the one-offs that you have in Success as well. So for electronic remittance posting, you do have the ability to review the information, see the information that it was not able to match up correctly, and work those exceptions directly from here. So in going through processing your remittances, this is the process and the area that you would go to do that. Okay, I'm going to stop real briefly here just to look at a few more questions that you have. Can you check out without processing the charges? You do have the ability to just mark the patient checked out without actually following through on the entire checking out of the patient or the processing the charges yet. You can just mark them checked out. After you posted the charges, the system automatically is marking them to be sent so that, you know, the system's going to know that they have that insurance, and it's automatically going to mark them so that it knows to include them in the next batch of charges that you're doing. Okay, and there was a note as far as the diagnosis limit is based on the claim format definition. Oh, okay, it is set to 12 diagnoses that you can do. So thank you, Angela, for responding to that. So there is a limit of 12 diagnoses. And will it scrub the claims? The system has some basic front-end claim scrubbing, like the front-end edit types that are part of the system. You also have some clearinghouse scrubs that are done. But if you wanted the full like CCI type edit, CCP, then you could use a third party. And we do have Alpha 2 Code Wizard that's available, but that would be a third party product. So if somebody's asking about Alpha 2, yes, that is available today. And how do we handle the billing, processing, payments of the claims? Okay. As part of the conversion from Success over to Entergy, we are going to be bringing over detailed financials from Success. So all of your payments are going to be entered as payments into the Success, into Entergy, your charges, your claim line items. So you will actually be able to work your claims, post your payments, all inside of Entergy after the conversion. You should not have a need to go back into Success any longer because all of that data is being transferred for you. And looks like we have one more question here before we go back in. Can you post the co-insurance and the deductible at check-in? Yes. And I'm not sure if that's relating more to like when we're going into posting payments, but that's where we're heading in as well. But if you know the co-insurance and the deductible, you can enter those into that manual entry mode so that you can actually see that information by putting that into the manual eligibility. So if you know that information, it can be entered at that point. Okay. So that is some of the basics of going through and doing those, but let's look at actually posting a payment. You can go into posting just a basic payment that a patient has mailed in, but I'm going to jump over and go into insurance. But notice that we also have a special area for capitation. So for any of you that are dealing with any capitated contracts, maybe an ACO that is capitated, you do have a special area where you can also go in and do capitation. But what I want to do is open up the insurance payment posting, and this would be for your non-electronic remittance payees. Okay, so if a payer is sending their remittance electronically, those would be going through that ERA functionality that we looked at a little while ago. So this would be for the ones that you're actually receiving the hard copy remittance from. I could go in and say that I'm going to post by claim number and actually enter the claim number in it. So if that's the number that I have, or if I want to do it by patient, I could go in and select the patient. But I want to show you a different way of doing it, and this is by the plan. This is an option that we really didn't have in Success, where I can go in and say, well, I'm only looking for payments that are related to Blue Cross 01 here. And I can go in and I can indicate, that I want to select a payment that I've already got in the system, or I could enter a new payment. So if I said, okay, well, I just got this check for $500 and that's the one that I want to post, I can have my check number associated to it. So that now it's going to be counting down my funds for me. So as I'm going through, what it now has brought me up, and in this case, I have it sorted by patient alphabetically. I could have sorted it by claim number. So depending on the order that the remittance is in that I've received, what it's showing me here are the patients that I'm expecting to get a payment from that particular health plan. So when I come down here, I could go in and say, okay, they sent me a $30 payment. So I want to go ahead and type that in. Also notice down here, it also shows me what the approved amount was for that. If there was an adjustment, I could put in the adjustment amount, any withholding, deductible, and the copay came in automatically because I'd already told it what the copay was. So the system then knows what the co-insurance calculation should be, and I have it set to take the next action of billing the next responsible party. In this case, they don't have a secondary, so it's telling me that unless I change something, it's going over to the guarantor at this point. If I were then finished with them, on my keyboard, I can just be using my down arrow and going down to the next one that I want to apply a payment for, going down to the next one. So without having to leave this screen, I'm going from patient to patient and posting those payments so that I'm not having to go in and search for individual patients. So if you're getting a remittance from one plan and want to have a grouping of all of the payments together, you do have the ability to do so. Okay. If I were done with posting at this point, then I would just say post. It's counted it down for me to allow me to see, and then I can come back in later and continue to work on that. The journal that I'm currently working in is just this one that I've called general. But if I wanted to see other journals, I do have the ability to go in and review and see, or if I needed to change before I got started, I could have come in and changed to a different journal as well. So you do have the ability to do some different things like that, but that's way, if the patient, if I had gotten that payment, I can follow through, I can see what the secondary is being filed. If I needed to do things like open up and look at the patient information window at the same time that I'm posting that payment, I do have a quick button here that allows me to do that without actually leaving what I'm doing. If I needed to make changes like typing in the ICN number, or make a notation as to something, in regards to how I had allocated that payment, I can do that as well. A couple of other questions that have come in. Let's see. Do we re-enroll with the insurance plans? As part of the migration strategy from Success to Entergy, you will be assigned an EDI specialist who will work with you on getting you re-enrolled with the new clearinghouse. And so they will send you a packet of documents that allow you to tell them all the different plans that you participate with, and they will help you with that process. So you will need to re-enroll, but we do have an EDI specialist that will be working with you individually to assist you with that. Yes, the claims will automatically go to the secondary. So based on that next action we talked about on that previous one, when we're going through and making that payment, if the next responsibility is the secondary insurance that the patient has, it will automatically click to that, and the next time you process claims, that will be a part of it. Okay, checked in, not checked out by provider. That would be similar to that view that we were looking, that is the pending charges. And I could see that in a report format as well, but the pending charges would be equivalent to patients checked in, not checked out, basically. So that's the same type concept. The clearinghouse that Entergy utilizes is Greenway Clearinghouse Services. So it is a clearinghouse that we have in-house, so that we have been able to have more flexibility there by having it ourselves than using a third party. Can you transfer the plans from Success? So that we don't have to. You do have the ability, and I'll double check that, but I'm pretty sure on the conversion document that the insurance plans are one of the sysadmin files that we are bringing over for you. So as part of the conversion, we are bringing over some of the system administration files, and I'm pretty sure insurance plan is one of those. Tertiary claims, yes, if they have multiple, you can do multiple. And all the claims go through the clearinghouse. That is correct. So everything would be going to the clearinghouse, through the clearinghouse, and then on to the payers after that point. But that's how we would go about processing payments and doing those. Now, one thing you're going to see throughout Entergy is the ability to communicate among yourselves and other staff members. One of the key functions that you're going to see is the ability to send tasks from one user to another, and also to have the system automatically assign tasks based on different rule set. For example, here in claim control, the claim control window, it would be a replacement for like your claims management tool that you have today in Success, where you would go in to work like your rejections, your denials, some of the different things like that where you're needing to go in and process. You do have the ability within this tool to create your own filters of the things that you commonly like to work. And it may be as a biller that all I do is Medicare, so I just want to go in and pull up and just see my Medicare claims. Or maybe I just want to see things by a certain denial code or a certain diagnosis, certain provider. All of these different filters can be used to create my own work batch of data that I want to have presented to me. So if I had made some selections, I have the ability to save that filter, and then it would be on my available list every time I come in on the things that I want to see. You do have different ways that you can group that data as well. But here I'm looking at, for instance, rejected claims. So when I go through and highlight one of the claims here, on the right-hand side of the screen, at the top, it's sort of going to give me like a little UPS type diagram. Okay, it made it from billed, I billed it, it made it as far as the clearinghouse. Clearinghouse, it went on to the payer, and then they rejected it and sent it back. Right below that, it allows me to see the reason that that occurred. So in this case, it's saying that it was an invalid insured ID number. At that point, I may want to jump up and go and see if I had a copy of that card. Oh, in this case, I see I didn't actually scan a copy of the card. But if I had, I could go in and review that and see if maybe we had typed it wrong. And then I could go directly into edit and make that change at this point. Or maybe I've called the patient and I figured out what the new number is and I need to update it. So without leaving the window that I'm working in, I could just open it up and make a change to that claim member ID number directly from here. So I do have the ability to make changes from where I'm at. Or, if I just needed to go in and look at more of the claim data, I could open up the details, I could see it. If I actually wanted to view more details on that particular claim, I can actually open it up and see the details, the diagnosis, what the line items were. So all of the information related to that claim, I could open up and look at without leaving that window. If I noticed that I actually needed to make a change to the claim, maybe I look at it and say, wow, if I had only put that modifier 25 on there, they would have accepted this. I could go in at this point and maybe add that modifier to it and then save it, and then that change would be made in the system as well. If I had made an update like any of those different things to resolve what the issue was and I was ready to rebill, here at the top you see different options. I could say rebill, and the next time I process claims, this claim would be included. I could also add a note. Maybe I just want to put a notation in of something that I had done on that claim, so I could go in and add a note. I also can send a task to another user. So maybe I say, well, the problem with this, and these are just some common different things that maybe I wanted to go ahead. Maybe there was a check returned, or I needed an updated diagnosis and I want to send that message over to the provider or over to someone on the clinical team. I could actually task that to the provider or the nursing group, and it could be a group of users. It doesn't have to be just an individual. I can actually send it to that user directly from here. And also notice that you can say, do I want it to automatically hold this based on the fact that I'm waiting for a response? And in this case, that's what I've got it defaulted to, but I could change that if I said don't put it on hold. But if I wanted to hold it, it's now going to add a notation for me here so that I can clearly see that that claim is now on hold. And down at the bottom of the screen, it's going to show you details of the steps that have transpired in relationship to this particular claim. If I needed to snooze the claim, I could go in and snooze, then it would come off of my active list until that time had expired. Or if I needed to appeal it, I can do appeal letter directly from this window as well. So again, I think this screen is another example of the efficiency that you can gain by utilizing Entergy in the system, that you're not jumping around the system, going from place to place to make corrections, make changes. A lot of those things you can do directly from where you're currently located. Okay, I'm going to stop for just a moment. We've got a couple of other questions that have come in. Let's see. Okay, there was a question about if the patient had made a payment like at check-in, or the patient made a payment after they were seen, wasn't taken at check-in, so I'll go back and show you that. And then ERAs, those would be coming through the clearinghouse. If they were processed prior to the conversion on success, let's ask, we'll make a note to ask exactly how those remittances would be processed. Let me ask about that one because I'm not sure about that question. So we'll make a note of that and get back with you on that, Julie. And then make the correction to the rejected. Yes, you can file it directly from the same screen. So if I had made that correction, I would come back over to the billing, and then I would be able to come back over and refile it directly from this screen. Okay, so I'm going to go back over. There was a question about if the patient were making a payment like on the back end, how we would go about that. And I don't know if you're referring to like if they're collecting that at the charge entry window, but if you were, you would go in and then the system will prompt you here at charge entry to collect that money. Another option I want to show you though also is if I just go in and select the patient's name, I also have the ability to do a pre-collect that can be done at the front end, that I'm collecting money that I'm not ready to apply yet, or that the patient just came in and made a payment. I could go ahead and put that in as a pre-collect, indicate the amount. You know, if the patient's saying it specifically needs to go to a certain provider, department, things like that, you do have the ability to do that. Otherwise, it's going to be applied to the oldest. So you do have some different tools that you can do there. If I were working with just like mail-in payments, then I would go directly to account posting here. This allows me to see the different guarantors. I could go then and open it up and post the payment specifically to that patient, to that particular guarantor. So depending on where you're getting that money and what the timing is, you do have the ability to do it in a number of different ways. Couple of more questions. Do you need to finish billing and posting everything before transition? We'll ask the conversion team. I do not know that you have to have everything posted at that point. I personally would think that I would try to, you know, get as much of my open batches posted, my claims sent. But we'll confirm that with the migration team as to what those requirements would be. Okay, one more question here. Yes, if I wanted to go in and just send an issue to a user, as I'm reviewing information, I was looking at just ones that maybe were problem, you know, different types, but you have the ability to go in and search for claims based on different types of parameters. So I could go in and just pick a particular claim, and then I could go in, let's see if I can find one for someone here. So I could go in and pick up any claim and task that over to another individual. So it does not have to be just a rejection or denial. If there was a particular issue with the claim, I can task that over directly to another user. Now we keep talking about tasks, so I want to show you what your task list might look like for a user. Now you have the ability to have just like your shortcut list over here. You also can have that set up more in a table format so that I could see all of my different tasks. You can group your task into the different types of things that have been assigned to you. So if I were looking to just work the ones that needed updated diagnosis right now, I could open just that subcategory of task and see the ones that were outstanding. So I see the list on the left. On the right-hand side, maybe I've gone through, I've talked to the provider, I've already done that. I could go in and mark that complete, and I could add a note to it if I wanted to. This quick text button that you're going to see throughout the system is where you could go in and go ahead and add some of the standard things that you say over and over again. In this case, when I'm, you know, actually working updated diagnosis, so I could say, well, the doctor said it was already updated to the highest level. If that's a message that I find myself doing, you know, over and over again, I could already have that in my quick text. So instead of having to type it in each time, I just select it directly from those. Also, I have the ability to say, you know, I need someone else to help me with this particular, you know, item, and I can forward it on to another user or another group of users. But you notice now it's come off of my work list because I've sent it over to someone else. Or if this was an item that someone had sent to me and I wanted to reply back to the person that sent it to me, I can just use the reply button and go in and either add a note or select a note from that quick text option. Each of the different items that you're forwarding, also notice that you do have the ability, let me just put one in here, to say low, medium, or high priority. So if this is something that you want to come to the top of their list and that they can, you know, go in and divide out the high priority items, you can mark items low, medium, or high. You also can just add a note. If there's something I want to add a note of some step I've taken or an action I've taken. Okay, somebody just said they've lost vocals. Is that across the board? One sec. If someone else could just send, okay, so it's just, okay. Most people, it sounds like, can hear us. Okay, fine. Somebody had said they had lost vocals. So if that was, if you're still having an issue, it may be that you need to reconnect to the phone line or to the computer. But it does not appear that we've lost it as a whole. Okay. All right, go back and answer a couple of more questions here. Rejected claims. You can't have the rejected claims go to a specific user by provider, but I can have a filter set up but for a particular user so that the user just goes in and selects a filter that has just the rejected claims for a certain provider. So it doesn't automatically assign those to that user, but you do have the ability for that user to just pick up those ones. Let's see, is there a medical records module? As far as if you're talking about the clinical documentation, yes, there is, and we will be looking at that today. I think we start that at 2:30 today, that we will be looking at the clinical, the medical records module. So if you're interested in that. Next question, exporting a list of work tasks, you absolutely could. Any of the reports can be sent to Excel or to Access, so if you needed to export that information. We also have a dashboard that allows you to see how people are doing on completing their task. So there is a dashboard, so if somebody was saying, you know, I'm concerned because I think Pat is just not, you know, following up on her task, there is a dashboard, and we'll be looking at the practice analytics later today that will allow you to see that. Okay, let's see. Okay, does the task take the place of the website? You have to log into overdue claims. Yes, you would actually be able to work the task, and the claims control would allow you to work the past due claims directly inside of Entergy. Can you automate reports to run every day, week, and month? Yes, that is part of practice analytics as well. Again, when we get to practice analytics, and actually that will be the next section that we're going to be starting at 1:30, I'll show you the ability to schedule your reports, and those could be weekly, daily, monthly, whatever's appropriate. I have another question. Okay, at the time that you're doing the checkout process on that same screen, if the insurance was different, you do have the ability directly from the checkout screen to change the insurance, add a new policy, things like that. And also the system can prompt you to collect the copay at the time of check-in or at the time of checkout. So you would be able to do that. You do have the ability to send reports from the schedule to users as well. So you do have the ability to do that. Okay, and a question about if I were on the claims control and I made a change like to the member ID number or to the birth date, that is actually updating the demographic data. So you're actually correcting that data in the demographic information. So yes, if you make that change there, it's automatically in the demographic screen. You're not just making it for that one claim, you are making that correction. And the system automatically will be prompting when you're looking at checking the patient in. You do have the option for it to come up and allow you to verify the insurance. And that's part of what we call that actions and events, where I can set up the different things that I normally want my staff to go through at check-in or when making a new appointment or registering a new patient. I can have it prompt them to take certain steps. So if looking at and verifying the insurance is the correct insurance for today's visit, that can be one of those prompts at that point. Okay, I think I'm up to date on my questions there. So that is the tasking capabilities. We've looked at the financial posting of the payments. We've looked at doing the charges. There are a lot of other sections. We're not going to go into all of these today, but I did want to show you, like for your collections, if I were working collections, this would be replacing like your collections module that you have in Success today, allowing you to see what the steps are that had previously been taken with that patient. So if I had sent out letters, if I had made phone calls, if I needed to add a task that I had taken, I could come in here and manually add to that collections process if there was something that I wanted to make a notation of. Also, maybe I got the patient on the phone and they wanted to make a promissory that they're going to be paying me $50 a month. I can put in that start date. I could also indicate an end date. So if I wanted to go through and say this is going to run for the next, month, 2 months, whatever I wanted to do, I could go in and add that promissory note. If I just needed to add a note in general for the collections review, I have the ability to do that as well. Or actions, if I wanted to go in and say, I want to review it, I'm making a call to that patient. So these would be like those different action steps that you can do in the private pay collections module today. So you do have the ability to do collections in a similar type fashion that you're accustomed to. Okay, is that any question? I think I've got one more question that has come in here. No, I'm sorry. I had already answered that one. Excuse me. Okay. So that's how you could go about doing the collections. Statement processing, you can send electronic statements for those of you that are doing those. You also have the ability to print statements on demand. So if a patient wanted to, actually have a statement and you were going to print that out for them, you do have the ability to actually print them out a demand statement and provide it to them directly from this screen. You also can see statement dates for certain dates or time frames. So if I were wanting to go in and actually look at that for a certain time frame and then do that demand statement based on the time frame, you also have the ability to do that from here. If I needed to go in and review charge data, I can go in and look at any particular line item, go in, see the information, and depending on the status of the claim, I may be able to make changes to that. I mean, some things would still require more of the reversal if you had posted it, but some things like maybe adding a modifier I can do without actually having to go and reverse the claim. Or, looking at the diagnosis, different types of functionality similar to what you do now as well. So you do have some additional tools there that you can do. If you wanted to view or print a claim, here from the claims module, if I wanted to go in, I could select it and then go in into demand claim and actually generate a claim directly from this window. So you do have the ability to do a paper claim directly from here. Or if I were reviewing this and realized that I needed to resubmit that claim, I could come down here to rebill, and I could go in and rebill that claim electronically directly from this window as well. Sending out statements is part of Entergy. That's where if I were doing electronic processing of claims, you would see the claims had gone out electronically. I could have those sent out in a batch like through an internet provider like you're accustomed to. Or you could print hard copy as well, but probably most of you are accustomed to using electronic claims processing in today's world. Again, you have a number of different reports that are available to you. So if there were particular financial reports that you're accustomed to maybe normally like to going in and running directly off the menu, you do have a number of real-time financial reports that you can run from here. Also, as part of Practice Analytics, you do have dashboards like the financial summary dashboard that's going to give you information about how you're doing as an organization. So for instance, if I wanted to change and look at a particular year or a particular quarter or month to see what my charges, receipts, net collections, adjustments would look like, I do have dashboards that have been designed around those purposes. I might then want to further narrow it down to just a particular location. So I have the ability to do it by location, by doctor, by insurance carrier, so different ways. Also, within these reports, you're also going to see that a lot of them have this little selector as an option. So right now, this report is breaking down by doctor and location, but I can say, you know, I really want to switch to plan class. So now the graph that I'm looking at is giving me charges, payments, adjustments, but it's breaking it down into the categories based on the insurance plan class. Or maybe I want to do it based on procedures. So all of these different options are available to you as ways that you can go back and reselect the view of the data that you're seeing. If I wanted to see a payer mix, I could bring that up, look at my payer mix. All of these reports do have the option of sending these to Excel. So I could export the information by selecting Excel here to send that information directly to an Excel format. If I wanted to look at my gross versus net collections percentage, I do have the ability to see those things as well. Your adjustment mix, posting lags, and then the selections window is where I can further define that I want to see things by a certain location, but only for a certain E&M code, for instance, or group of E&M codes, certain doctor, by specialist, things like that. So you have all of these different parameters that you can use to further define what's being represented to you in the reports and in the dashboards. Okay, I think I had a couple of other questions that have come in as well. If the front desk, if the front desk does not have access to financials to yes, they absolutely can still use that pre-collect to go ahead and collect money up front, and then it would be sitting there waiting for someone else to post it later. And then the dashboards, yes, absolutely, they can be exported into Excel or to Access database, different things like that. On these graphs, dashboards, can we see the details? Okay, some of the things, yes, so that as I'm looking at the information, some of the different graphs give me the ability to drill further into that data, not all of them, so it's going to depend. So like if I were looking on the financial ones, you don't have as much drill through capabilities, but I have supporting reports that allow me to get into that information. So you can search through the reports. You do have the ability to drill into certain sections or do select all type functionalities. So some things, yes, I can drill further into, but not everything. So I don't want to give you that intention. But like if I were like looking at my clinical CQMs, for instance, I could go in and see as an organization how we're doing on a particular measure. And when I get over to measure details, I do have the ability then to see the detailed information of what's included. And then if I wanted to actually see the visits that were being included in that account or just who's in the numerator, I want to see the exclusions, so I can include here at the bottom detailed information. The same will be true for your UDS reports, so for any of my FQHCs that are on the line. If I wanted to drill in like and look at that financial report, when I go over to the report detail, it is going to show me the information in the format that I would be accustomed to seeing my UDS information. And then at the bottom, I could say include the patients that are making up those numbers, or include the charge detailed information that's included in those numbers. So you will have different drill through capabilities in different areas of the system. Okay, there's a question about using financial groups inside of Entergy. Okay, in Entergy, it sounds like in the case that Amanda, you're asking about, that would be in Entergy something called a practice unit, where within my organization, I have two distinct financial groups that need to be totally separated from each other, where I'm not sharing financials, I'm not sharing charts, things like that. I would set those up as separate practice units is the term that Entergy uses. Financial groups in Entergy may also be what are called service centers. So in many cases, the financial groups that some of our centers are using are not really where I'm totally wanting to separate them out by financials. I still want to share electronic health record, things like that. So what you're setting up as a financial group today in Success may be referred to as a service center inside of Entergy. So it really just depends on how you're using the financial group as to what the equivalent would be. As far as another question came in as far as looking at how you would audit claims. And that's where if I were looking to see prior to sending the claims, if I wanted to go into the insurance billing and do the pre-billing of those claims, I would go in and select, that's like doing your prepare status for it to go and gather the different claims. And then once I've done that, here at the bottom, I would be able to see those claims that were in that batch. I could actually then go in and task that to someone if there was something I wanted someone to take a look at in regards to that particular claim. Or if I wanted to go in and look at the errors before, I actually sent. These would be the errors that the system had found before actually sending it out, like not having the consent. I could mark that I had reviewed that, or I could actually go in and indicate that I had resolved that by going particularly to that area. So if there were things that I wanted to look at prior to sending them to the clearinghouse, that pre-bill is where I'm preparing them, running them against front-end edits, and then I can review them before actually transmitting them out. Okay, another question. How will we be able to download complete medical records to be sent out? Okay, if you needed to attach a medical record, you do have the ability to come in and select patient chart. So if I wanted to send out a full chart, I do have the ability to send out a full chart of that patient's record, or I could limit it by date range or by encounter, or, I could do all dates, and then I can select any of the different things that I do not want to include. So I do have the different options to do that. Okay, can you print the 1500 template? I mean, I can print a demand claim. So I don't know if you're talking about a plain, a blank template. But let's make a note of that, and we'll come back to you on that question because I'm not sure exactly what the question is there. But you can print a demand claim directly out of the system. Okay, guys, I think we're coming up on the end of this session. The next session that we will be moving to, which I think you're all going to really like, is we're going to go back into that practice analytics tool at 1:30 and look more at the ability to use that tool for scheduling reports, things like that. So we are going to go on another 5-minute break. So if you need to switch audiences or, run get you something to drink, now's the time. You have 5 minutes and we'll start back up promptly at 2 o'clock.